I'm going to talk about the changes that we encounter during our adult life and the manifestations of which are seen in the mouth. So let's just begin. What is gum disease? Like any other infection, gum disease is caused by a pathogen or a germ which attacks the gums, leading to gum disease. What happens to the gums? The gums are red, swollen, there's bleeding spontaneously or while brushing, there's bad breath, and also a foul taste in the mouth. Imagine a war. We have a huge army of ourselves and are being attacked by the enemy. The number of soldiers in the enemy is constant. Our soldiers are also constant, but depending upon the weapons that we possess, we can either win or lose this war. A similar situation is going on our gum boundary. The number of bacteria that are attacking is the same, but how the gum responds to this bacteria changes. The hormones are handing out the weapons to our little soldiers at the gum level. So what are these hormones? Hormones are substances released by the glands of the body called endocrine glands. These hormones are pretty much responsible for the overall regulation of the body. Today we are going to talk mainly about two hormones, estrogen and progesterone. The biggest fluctuations in this levels of estrogen, progesterone and to some amount testosterone also happens during puberty, pregnancy and menopause. Puberty for the girl child is between 11 and 14 years of age. However, early puberty of kids as young as 8 is also documented. During puberty, the estrogen levels increase and the gums react far more aggressively to any bacterial onslaught. This is further compounded by decreased parental supervision. Children don't like parents telling them to brush their teeth in the night, brush their teeth in the morning, sometimes late nights, junk food, midnight snacks. All this is a perfect picture for the bacteria to get harbored out of the gums. Sometimes you might have experienced some tightness in the teeth and gums and occasional bleeding just before or during your menses. But this is completely and totally temporary. Next we come to pregnancy. In pregnancy you might see swollen, red and bleeding gums, especially in the second and the third trimesters of pregnancy. During pregnancy, antibiotics should be avoided. So it's very important that a good oral hygiene is maintained from the first trimester itself. Also, good nutrition and supplements are required during pregnancy. Untreated gum diseases during pregnancy may contribute to premature birth and low birth weight. Sometimes a little swelling between the two teeth at the gums called a pregnancy epulis also forms. After the baby is born, this swelling normally regresses. Excision of this epulis is not recommended during the pregnancy time, mainly because it might cause bleeding and we don't want to give antibiotics again. However, if the swelling is very big, it can be excised. No, the baby is not going to take all the mother's calcium, causing her teeth to fall. In fact, if there's a nutritional deficiency, the baby is going to be impacted much more than the mother. Cleft lip, cleft palate are seen much more where there is nutritional deficiencies in the mother during pregnancy. Next we come to menopause. Menopause is a very difficult phase in a woman's life, not only in the physical sense but also in the emotional and the mental sense. There's a decrease in the levels of estrogen, leading to thinning of the mucosa and the gums. This is further complicated by decrease in the saliva. Saliva is very essential because the continuous flow of saliva flushes the entire mouth. Apart from that, saliva contains enzymes and antibodies to heal and protect the gums and mucosa. You must have seen animals lick their wounds to heal them. And overall, there's a decrease in the calcium also. There's osteoporosis all over the body. Similarly, there's osteoporosis also in the bone surrounding the tooth. Menopausal women are recommended to do weight-bearing exercises. Unfortunately, here we can't do any weight-bearing exercises. However, what we can do is we can have excellent oral hygiene by regular brushing. I recommend water flossing twice a day, visit to the dentist regularly for cleaning, replace all the missing teeth. When you don't have teeth, your nutritional suffers. You will not have high fiber diet. You will avoid salads, fruits, vegetables, going towards a more high carbohydrate diet, and you'll have nutritional deficiencies, gas, bloating, acidity, and lots of complications. So replacement of missing teeth is equally important. So, whatever phase in life we might be, whatever might be a situation, when there is a woman, there is a way.
Thank you for an informative lecture, Dr. Sonal. And I have a query. How do you advise brushing? How many times a day would a normal person brush? And is there any a pregnant woman should brush more or something like that?
Twice a day brushing is important. However, I always recommend to brush after breakfast in the morning and just before you sleep in the night. These are the two, it's not how many times you brush, but when you brush also, which is very important. And for pregnant women, yeah, it's not only about brushing, it's about also water flossing, keeping your gargling. All the different adjuncts also are equally important as much as brushing. So if you are eating a very, very high starchy carbohydrate rich diet, then yeah, you're having a caramelized chocolate, you need to brush after that, especially for pregnant women. And otherwise also for, regularly for everyone.
Do you advise a mouthwash for any normal person or?
So I don't think so. Mouthwash is really required for a normal person. It's just a feel good factor. Uh, a brushing and flossing is more important.
And I have a question about my daughter who is there in Kerala. She's 23-year-old and she has gingivitis, and I cannot find plaque at all in her mouth. And she keeps complaining about bleeding gums. What can be
She's
the
20.
cause?
Does she have mouth bleeding?
23 years.
Does
Yeah,
she have
that I
incompleted
haven't.
lips?
No.
This is one of the reasons mouth breathing also can cause gingivitis, especially in the anterior
Okay.
region. Okay, is it gingivitis
Okay.
all the time or is it during only certain periods?
She's having gingivitis all the time. She keeps on telling about bleeding gums, and she keeps going to dentists, and scaling will be done always. But again, that complaint persists.
When has she last got a scaling done?
Maybe 1 month before.
Sorry,
1 month before.
1 month before, and still the gingivitis has not decreased in spite
Yes.
of the scaling.
Yes.
So you must check. I
They are
think it's more of
advising
a.
deep scaling.
It could be because of an ortho problem also, because of mouth breathing also. Probably she has some occlusion problems. That's the reason also she could have gingivitis. It's not only because
Okay.
of plaque.
Okay.
Like I said in the presentation, it's not about the plaque doesn't, in any of these situations, plaque will not cause gingivitis. It's the response of the body that causes gingivitis when you have a hormonal change.
O- Okay. Thank you very much, Dr. Sonal.
Thank you for having me over here.
Thank you.